Your Excellency, due protocol observed. I want to begin by saying that, Your Excellency, if there is something you did in this country that will always remember you, is to bring that man in the Ministry of Health. That Eden Twale in the Ministry of Health. And he has brought up a team that is actually working. Plus his PS, Uma Oluga, PS, the most smiling and the doors always open. Mary Muthoni, very welcoming and workaholic. And even Director General, Dr. Moth, and the entire team at the Ministry of Health. Your Excellency, these people are working today. Be as it is, Your Excellency. We can say we have, first I want to admit, because I must speak with a clean hand, I was one of the serious critique of SHA when it came up. And you know, you used to ask me, it is you who brought SHA because it is us that formed this government. Our issue was not about the services to be provided. Our issue, I was being pushed by the people I was leading. They were saying 2.7 was high. But I can admit to you, Your Excellency, that SHA works. Every month, I spend about 100,000 shillings supporting my people in my constituents. I pay between 6,000 and 12,000 every month. Everyone telling me I'm sick, I say, have you registered SHA? No, I cannot pay your hospital bill. Go, get assessed, send me the assessment, then I pay, you go get treated. It is working. Only that we have a few people who are very poor, they can't afford. You assess, somebody tells you, I have niko na nyumba ya mapati, kumbe the husband built a house and he died. So they give you pay 8,000, yet you cannot afford that. Maybe that's the area that may want to be revised. Your Excellency, I want to thank the Minister of Health. We have had problems, as my colleague said here yesterday. Every year we have been having problems at Minister of Health internship. We fight, we destroy things, the Minister of Health. There is one particular year where we broke things, the Minister of Health, and the interns were surcharged. Today, as we are talking, under the leadership of your Apple CS, Honorable Eden Twale, there is no breakage, there is no mandamano on internship. That disease has been cured. Secondly, Your Excellency, the issue of universal health coverage, which you and your brother, former president, employed during COVID-19. Through his guiding and support and working with Parliament and all people responsible for revenue allocation, 8.6 billion was allocated for absorption of UHC staff into permanent and pensionable. But as we speak today, nurses in this country are on strike because the county government have refused to absorb these UHC staff. It is our prayer, Your Excellency, that national referral health facilities have acute shortage of nurses and other healthcare workers. Since you have the money, why can't the Ministry of Health just take these nurses and other health workers to the national health facilities? Your Excellency, we can talk about medical products and technology, health information system. Of course, the health information system has worked very well. You know, that's why yesterday you said that Kinamugos have been removed from the system. I will want to say, under that health technology, health management system, they should be linked to the medicines and even equipment, so that if Governor Sakaja has supplied medicine to Hospital A, there is somebody somewhere who is in charge of looking at the system and knowing that this medicine is in stock. So that if a client goes and is told, this medicine is not there, and he calls that number you want to establish, a person who is not in that hospital will be able to call that hospital and say, our system shows this medicine is in stock. Why are you not giving out to the public, the patients? For us as nurses, we are happy because, Your Excellency, our services we don't refer. Nursing services we cannot tell you go and get it outside. We will give it because we always have it. So we may not be actually affected by that. Your Excellency, a demotivated workforce, a workforce that has not been paid, cannot deliver services. As we talk today, yesterday, Your Excellency, you said all the county government received their share of revenue for the last financial year, 100%. County governments today, Your Excellency, have not paid statutory deduction and third-party deductions. They have not paid loans. They have not paid pensions. Some have not paid loans in the last financial year. As we speak today, August is coming to an end. Health workers have not been paid salary for July. They have not been paid salary for August. Will end next week. How do you expect these health workers to go to work, to feed their children, to pay rent? You are embarrassing health workers in this country. If you are a health worker or a public servant and you have been paid salary and you don't pay for your rent and your landlord throws you out, Your Excellency, human resource policy requires that you are disciplined because you are embarrassing the employer, who is government. Now, since we are the ones being embarrassed, what do? Can we sack the employer? The only weapon given to us by the Constitution of Kenya under Article 41 is to go on strike. So we are asking, we open a conversation. Are we ready as Kenyans to continue having the healthcare system that is very critical in the hands of devolved system where only 9 counties, Your Excellency, in this country have had their budget passed up to now? 14 have never submitted their budgets. 24 have had their budget rejected. Are Kenyans ready to have the health human resource with these administrators who can't even have their budgets passed, who can't even afford their budgets? This is a conversation that we need to open.
Thank you. Thank you very much.
Your Excellency, the last one. I cannot sit with before saying this. I'll be lynched by members. I'll be lynched. Your Excellency, in 2017, you and President Uhuru Kenyatta gave nurses a return to work formula, where you improved our terms and conditions of service. From that time up to now, that return to work formula of 2017, Your Excellency, has never been implemented. It has been a cause for 4 strikes, including the one that's going on right now. I know you have goodwill, and you mean goodwill for this country. Through your goodwill, I'm requesting you to ask the chair of the Council of Governors to sit down with us on Friday, have a solution. And SRC should be on board. Because in 2017, we had that CBA, it was taken to SRC rejected. And today, even if we sit with Council of Governors and agree, and SRC rejects, the strike will still continue. So I'm requesting you, I know you mean goodwill for people, talk to the Council of Governors, SRC, so that we sit on Friday, because we have a meeting on Friday, we complete and send our people to go back and work. Thank you, Your Excellency.
Thank you. Do we have any other representative of healthcare workers?
Any clinical officer?
Okay.
He's up there.
Proceed.
Proceed.
Yes, and I'm very excited, Your Excellency, to be here today. I think the other time we met, Your Excellency, before you became president in Catholic University, I'm the one who gave you the memoranda on behalf of my good friends from the unions. And we have the other unions for public health,